Hi everyone, it's Dr. David Morris with Magnolia Medical Center here in Murfreesboro, Tennessee. And I want to shoot a video. It's the beginning of 2017, and I want to talk about a subject that everybody seems to want to talk about at this time of year every year, and that is how can someone lose weight? And probably more importantly, how can we keep it off? And so many people struggle with that. We've been dealing with, talking with patients for years now about how they're not able to lose weight, and they're trying all the right, they seem to be doing all the right things. They seem to be eating right, they're exercising, they're doing Zumba in the morning and hot yoga in the afternoon, and they just can't seem to lose weight. So we're going to talk about weight loss for the hypothyroid mom and maybe some dads out there that are also having trouble losing weight. And we're going to talk about the different forms of hypothyroidism. This will be a short video, but there's an interesting thing when I say that is patients come to our office and they're almost all treated for the same form of hypothyroidism. And when there's an interesting thing that happens, they say, well, what do you mean different forms of hypothyroidism? Folks, there's not just one. There's actually 6, and truly there's actually 7 forms of hypothyroidism. And when people go to their doctor, maybe they're on medication, maybe they're on Synthroid or levothyroxine, almost every patient that we see is treated for the same form of hypothyroidism. 99% of the people that come in the door, they don't even know what I'm talking about. They say, my doctor never even mentioned that there are different forms of hypothyroidism. And they're all treated for the same form, 99%, and yet there's 7 forms of hypothyroidism. So what I'm going to do is just go over those different forms because, and we're just going to do this shortly here and go through them quickly. We have a long video that you can watch. You can call our office and request access to our long video on thyroid conditions. But folks, if you're treated for the wrong form of hypothyroidism, it doesn't matter how much medication you take, it's not going to help. And you're going to be struggling to lose weight, struggling to keep it off, and you're going to have a hard time achieving those goals. So, again, there's 6 forms of hypothyroidism, and like I said, there's actually 7. We're going to talk about the 7th one as well. The first one is something called primary hypothyroidism. And what that means is it is your thyroid gland, the gland itself, the gland that sits right here in your neck, it's actually damaged. Something's wrong with it, or it's just plain lazy. It's not doing its job. Now, when I said people are treated, 99% of patients are treated for the same form of hypothyroidism, this is what they're treated for. This is what their doctors are working on, is primary hypothyroidism. Folks, it's less than 5% of patients that actually have this form of hypothyroidism. Less than 5%, yet 99% of patients that we see are treated for this. So not many people are actually, not many patients that have hypothyroidism walking around with a damaged gland. People get confused. They say, well, I have nodules. It doesn't mean the gland is damaged, or they have a goiter. Now, if they had cancer of their thyroid, or the gland is lazy, and you can find this out if you do the right lab work, and then this would be the right way to treat someone. But that's not the only form. Okay, we're going to talk about the second one. Hypothyroidism, low-functioning thyroid that is secondary to a low-functioning pituitary gland. So a pituitary gland is a master gland that's in your brain. It's the parent gland. It runs all of your other glands in your body. And if that pituitary gland is functioning at a low level, then your thyroid gland is going to function at a low level. And this is not looked for. As a matter of fact, just looking at TSH as a lab test would miss this form of hypothyroidism over and over and over again. It would look like you had a totally normal functioning thyroid when actually your pituitary gland is not functioning at all. And it would make it look like you had a normal thyroid when you don't. The third form is called liver underconversion. On my long video, we go into this a bit more, but your thyroid gland produces primarily a form of thyroid hormone called T4. Now, that form of thyroid hormone cannot be used by the body, so it has to be converted into the usable form called T3, and that happens primarily in the liver. So if something's wrong with the way the liver is functioning and you don't do the proper thyroid tests, folks, and minimally, you're going to look at 7 lab tests to determine thyroid function. Sometimes you need to look at as many as 9. Most of you are getting 1, TSH. But you would never find liver underconversion if you didn't look for all the appropriate through all the appropriate lab tests. Additionally, Since T4 is converted to T3 in the liver, primarily, if you were getting Synthroid or levothyroxine or a synthetic T4, it could make it look like you had normal thyroid hormone levels, but that hormone is never being converted to a usable form in the liver like it should be. So you still feel awful. You still can't lose weight. Your hair is still falling out. You're still tired all the time. You're depressed. All those symptoms that go along with hypothyroidism. So this needs to be looked for to determine proper thyroid function. Which form of hypothyroidism you have. Liver overconversion. Now this might sound like a good thing, but there's that old adage, too much of a good thing isn't that good at all. So you can overconvert, and then the system starts to shut down. So we get too much of the usable form of thyroid hormone, and the system starts to shut down. So we can't overconvert either. That's the fourth form of hypothyroidism. The fifth one is elevation of something called thyroid binding globulin. This is essentially, hormones can't travel through your bloodstream unattached. They have to be attached to a protein. Thyroid binding globulin is a protein that carries thyroid hormone through your bloodstream. If we have too much of these proteins, then the hormones don't become detached from the protein, and therefore they can't be used within the cell. This can be looked for. It's very important, and it is actually somewhat of a common form of hypothyroidism that again, you would never see this if you just looked at TSH. If you're just being treated in that 99% category, you would never know that this is the problem, and you're still going to feel awful, still going to have all those symptoms of hypothyroidism, still have trouble losing weight. Thyroid resistance. This is where the cells will not listen to thyroid hormone anymore. Your thyroid hormone can produce plenty. Your pituitary gland can be doing its job the right way. You can be converting the hormone the right way in your liver, and you can have the right carriers of the proteins, the right number of those proteins to carry thyroid hormone through your bloodstream, yet your cells are just resistant to it. So this can be frustrating, but this is a form of hypothyroidism. Now we're going to talk about the seventh one. And I say 7 because this technically isn't a hypothyroid condition. This is an autoimmune condition, but it's called Hashimotos. And this is where your immune system is attacking your thyroid gland. The problem isn't with the gland, the problem is with your immune system. Folks, look this up yourself. I encourage you, Google what I'm talking about here. You'll see that what I'm saying is absolutely in the research. Hashimotos is 90 to 95% of all hypothyroid cases are due to Hashimotos. That's what the experts in immunology say, the experts in endocrinology, the expert pathologists. They all say that 90 to 95% of all hypothyroid cases are due to Hashimotos, yet it's almost never looked for. And if it is looked for, it's ignored as far as treatment goes. Folks, listen, these are things that we love to help people with. We're very passionate about getting people well and helping them stay well. If there's something that you want to do to change your life, change your weight loss goals, change how you feel, change your energy levels in 2017, we can help you with that. Give our office a call. The number is 615-225-9100. We'd be happy to help you. We can certainly send you more information, a much longer video on thyroid issues. We can send that to you, and we look forward to helping you in 2017. Folks, have a great day.